It is a health challenge that has proved the biggest yet in the country's recent history, with the government dedicating huge resources to mitigate its impact. And while the efforts indicate progress in advancing towards national targets, as reflected in the 2018 HIV Estimates report, the latest demographic statistics present an interesting study. While the report released today by the Health Cabinet Secretary Sicily Kariuki indicates that the national HIV prevalence has dropped from 5.6% to 4.9% over the past 5 years, with about 1.5 million people living with HIV, young women aged between 15 to 24 remains the biggest demographics in new infections. According to the report, the group accounted for nearly a third of new infections.
The vulnerability experienced by adolescents and young girls and young people, including girls, continues to place them at a high risk of HIV that rely on action beyond the health sector.
The report indicates that more men, that is 13,800, died from HIV-related complications last year as compared to women whose number was 10,100. National AIDS Control Council Executive Director Nduku Kilonzo saying lack of testing is posing a major challenge in intervention programs.
And this is really issues related to low testing, especially amongst men. And this actually helps define some of the reasons why we have found that it was important to look at our World AIDS Day, which will be coming up on the 1st of December, and have men become, look at knowledge of HIV status among men.
New HIV infections among all ages declined from 77,200 in 2010 to 52,800 in 2017, indicating a 32% decline in the number of new annual HIV infections. Annual new infections among adults aged 15 and above also declined from 63,700 in 2010 to 44,800 in 2017, a 30% decline. Kariuki says that the government will intensify efforts aimed at containing HIV despite the positive outlook.
As I urge all the partners and stakeholders to make higher investment in this space, to also encourage us to be more innovative and cost-effective in terms of the approaches that we adopt, so that also the pillar of affordability in UHC can be attained.
While gains made over the years presents a cause for optimism in the war against the epidemic, concern remains with the statistics indicating that a third of the counties contribute to 75% of the total national new infections. Counties with the highest adult HIV prevalence include Siaya County with 21%, Homa Bay County with 20.7%, Kisumu County 16.3%, Migori County 13.3%, Busia County having a prevalence of 7.7%, and Nairobi at the rate of 6.1%. Reporting for Channel 1 News, I am Serfine Achieng, Oma.